Good morning. My name is Dr. Donald Moore. I'm currently a board member of the Physicians for National Health Program. I'm a trustee, chair of the Legislative Committee, and past president of the Medical Society of the County of Kings. I currently serve as co-chair of the Health Information Technology Committee and vice chair of the Committee on Physician Health for the Medical Society of the State of New York. My academic appointments include assistant professor at Weill Medical College of Cornell University and Downstate Medical Center. I'm in private practice, a full-time general practice in Brooklyn, New York. Here now I speak as an individual. Currently, I do not have health insurance. I expect that this will be temporary. I hope that my medical practice will soon generate enough income to pay for insurance for my family and for my staff. I had health insurance in 2013, the equivalent of a platinum plan, a platinum family plan, which cost me then about $2,000 a month. Due to significant hardship in meeting this financial obligation, I dropped the insurance in anticipation that with the implementation of Obamacare, I would go on the exchange and get a better rate. As it turned out, that was not the case. In fact, when I returned to my previous insurer, I was told the platinum plan that I had before was no longer available to me. They offered me the equivalent of a gold plan for the same rate. Same rate that I was paying for the platinum plan. After a few months with this gold plan from a leading commercial insurance company, the high premium, exorbitant co-payments and deductibles, and poor quality medical service that I received led me to the conclusion that it was not worth it. I dropped the insurance. The Affordable Care Act has not worked for me as a patient, an employer, a doctor, or a taxpayer. Since the Affordable Care Act left non-Medicare, non-Medicaid insurance under the control of private insurance companies, I, like so many middle-aged, middle-class patients, was forced by the individual mandate to choose from the limited, overpriced, narrow panel of commercial products available. My $2,000 a month gold product left me with a $30 copay for primary care visits, $60 copay for specialists, with mandatory gatekeeping by the primary care doctor. Higher cost interventions such as ED visits, radiologic procedures, surgery, and screening colonoscopies had a copay and deductible between $100 and $500. Add all that to $24,000 a year premium for my family plan made it not worth the cost to me. The risk of financial ruin from an illness seemed less. My visit to the doctor. My first visit to the doctor devalued the insurance product even more. Since I wanted to see my urologist, I was forced to schedule a primary care visit. That is gatekeeping. This was not a big deal. I'm a primary care physician, and I value preventive care. My appointment was 10 o'clock in the morning. I arrived at 9:30, filled out more than 15 pages of forms which seemed to be the 11th copy of a poor original of seemingly non-helpful intake information. I didn't worry, however, because the doctor would soon see me, get a thorough history, and do an exam. Well, the doctor called me in at about 10:05, and to my surprise, I was on the street at 10:17 a.m. Interestingly, I felt somewhat relieved. I'd not spent much time in the doctor's office. You know, I didn't have to loosen my tie. I didn't have to roll up my sleeve. But I wondered, did he even know I was a doctor? Does he know my age? He probably does know my age because I did all the paperwork, but why didn't he take any blood tests? Why didn't he examine me? I then felt cheated. I had spent $30 for that. How much more did the insurance pay him for that? Probably not much, as you probably heard. 16 to 30% of the premium dollar collected by commercial insurance is spent on administrative services. On reflection, it became clear to me, with the profit motive as the driving force in our free market healthcare financing system, clinical care is often inadequate and of poor quality, particularly primary care services. Why I don't take commercial insurance. As a doctor, I made a decision to stop taking commercial insurance as payment for medical services in 2012. The reason was that insurance companies expected me to provide primary care encounters in 10 minutes, like the doctor did to me. With the average primary care visit being reimbursed at about $50 nationwide, and my hourly cost to operate my practice was about $300 an hour, I would have to see 6 patients an hour to break even. I wouldn't do that. It takes me 10 minutes to say hello to the patient and to elicit the chief complaint, another 10 minutes to perform the physical examination, and yet another 10 minutes to conclude the visit with a diagnosis and treatment plan. For the initial visit and the annual visit, this process is extended to 1 hour. Because I practice this way, one insurance company accused me of upcoding and overbilling. They demanded money back. They stopped paying me for medical services delivered until I come and settle with them. This is long after I delivered the service. They went back 5 years. They didn't examine my medical records. They didn't come to my practice. Instead, what they did was a statistical analysis of my billing pattern over the previous 5 years and then compared it to what other doctors were doing. They refused to investigate their presumption of upcoding and indignantly stated that they did not need to examine my records. They demanded that I bill at a lower rate regardless of what level of service I provided. When I sought help from my elected officials and my medical society, this insurance company maliciously defamed my character. They accused me of violating my medical oath and referred to me as obstinate. I have learned that they've employed this approach with numerous physicians, and in a letter to my congressperson, they boasted that many physicians have challenged our methods, but none successfully. The insurance company owes me today $41,000 for services delivered in 2011. They will not pay me anything unless I settle with them. As a physician, however, I cannot accept legalized extortion from an insurance company. If this was an insurance company like Medicare or a state-regulated plan, there would be a process that I could appeal this. However, since this is an Employee Retirement Income Security Act plan, an ERISA plan, they are regulated by the United States Department of Labor, and this agency has no interest in managing physician insurance reimbursement. We need ERISA reform, or we need a single payer. I fear bankruptcy, my fear of bankruptcy. I fear the risk of being uninsured. You heard from my colleagues, 62% of all bankruptcies in the United States are due to medical expenses. Self-employed professionals and small businesses like me usually have to buy insurance on the open market. We get no large group discounts. Therefore, we pay the highest rate. When we get sick, the business, the profession, and the individual fail. 75% of medical bankruptcies started out with the patient having health insurance at the onset of the illness. It makes sense, therefore, that the society protect this high-risk, productive segment of the population. Typically, not only does this individual or entity like me, not only are we responsible for ourselves, but we're an integral part of the financial security of our families and our employees. This group gets nothing from the Affordable Care Act, but we bear the largest percentage of the cost. We need health insurance reform for all. Obamacare did not work for me. Obamacare is an inadequate attempt of our legislators to fix a broken healthcare financing system. It is inadequate because it does not address the root causes of the current system failure. It leaves in place the free market approach to healthcare financing with commercial insurance paid for by the individual and sometimes the employer and even the government. The solution, the single-payer solution. The solution is to legislate a more rational, planned healthcare financing system as exists in most developed countries. There should only be one insurance for everybody that provides comprehensive primary care benefits, appropriate access to emergency and tertiary care, and full catastrophic protection paid for through progressive taxation. As a patient, I do not need choices of many insurance companies with narrow panels limiting the choice of physician or hospital. As a physician, I don't need hundreds of insurance companies complicating my work and creating perverse incentives and policies to limit the care that I give to my patients. As a taxpayer and a citizen, I want to see these interlopers I do not want to see these interlopers employing and contracting with physicians like myself and hospitals to finance the corporate practice of medicine with one objective, the objective of extracting large profits from the healthcare delivery system. You heard, Medicare finances the care of a significant part of our population with only 2 to 3% administrative costs. We only need one insurance to finance a healthcare delivery system. To this end, I, therefore, as a patient, a physician, a small business employer, a taxpayer, and a citizen of the state of New York, support the New York Health Bill. Thank you very much. Thank you, Assembly members and senators, for allowing me to tell my story.
Thank you.